Good afternoon, everyone. Thank you for joining us today. Today we are joined by Kim Hunwardsen with Eide Bailly. And if you're thinking Kim's name looks familiar, we actually did a webinar series with Kim and Eide Bailly, probably 4 or 5 years ago, along the lines or along the topic of community health needs assessments. At that time, we were kind of diving more into tips for successful needs assessments, why we do them, and then just all the way through implementation. Today, we're going to be talking about how to conduct a successful community health needs assessment. And so, really walking through why we do this, but also how you and your team and your facility can conduct a successful community health needs assessment. And so, as we get going, we are recording today's session. So, if you are watching today's session live and have any questions, please feel free to put them in the chat or come off mute. If you're watching the recording, or if you share this with your team, or if you get into next week and you're like, hang on, I have some questions, please do not hesitate to reach out. I do not want anyone to feel like you're alone or you're left hanging. So if you have any questions about how do we do this, or where do we find this data, or can you help us with this data, please do not hesitate to reach out. And as we get going, if you have any questions at all, please feel free to jump in. Kim, with that said, I'll turn it over to you.
Perfect. Thank you so much, Lara. And thank you all for joining us today. It's a pleasure to be here. I'm always excited to talk about these topics. I'm, an expert when it comes to tax issues, and community health needs assessments might not seem like a tax issue, but they get driven by the requirement to do them is driven by the tax code, which is why you have a tax partner here today talking to you. With that, make sure I can do this quick disclaimer that information we provide here is, information only. I don't need to spend any more time there. But yes, my name is Kim Hunwardsen. I'm a partner at Eide Bailly, and I oversee our exempt organization tax practice on a firm-wide basis. So when we think about tax exempt organizations, that includes our nonprofit organizations, private foundations, and most importantly to you, our healthcare organizations that are treated as tax exempt. I know there's some hospitals within your state that maybe are governmental entities, unless those entities actually have a dual status and they are tax exempt and governmental. These rules don't necessarily apply to them. I've had the pleasure of working with Lara over the years in just answering questions, helping, as they've been a great resource to the hospitals in your state on doing these assessments, and also have had the opportunity to work with some of you maybe on 990 reporting or on other things. So it's great to be here. We're going to talk today very specifically about community health needs assessments. We're going to start with the technical background because that's why we do this, is it is a technical requirement that all hospitals complete a community health needs assessment. We'll talk about the process, and we'll give you some best practices, some ideas that have been developed by both the work that Laura and her team have done, work that we do when we work with organizations on doing their community health needs assessments, things that I've seen as I review community health needs assessments for reporting in the 990. And then we'll talk specifically about that reporting. So it's not enough for you to do it. You actually have to report back to the IRS to show that you've done this process, and we'll go through what those requirements are. As Laura said, as we go through this, feel free to drop a comment or a question in the chat. If you instead want to unmute and ask questions, feel free to do that. And I will save time at the end and stay available to answer any questions you have. So let's start with the why. Why do we have to do this? Well, in 2008, the IRS or Congress passed new rules that were called the 501R rules, which added requirements for tax-exempt hospitals in order to maintain their 501c3 status. So before these rules were in place, the requirements for 501c3 status were pretty vague. There wasn't anything in particular that a hospital needed to do to have 501c3 status. There were some guidelines, like you needed to have an open medical staff, you needed to treat Medicare and Medicaid patients, you needed to have an open community board, but there weren't any specific rules. So these come into place to give us specific rules that 501c3 hospitals have to follow. And there's really 4 components. Obviously, we're only going to talk about the first one today, but that is you need to conduct a community health needs assessment once every 3 years. You need to have a financial assistance policy and emergency care policy, and you need to make those policies publicly available to members in your community who may need to apply for financial assistance. There's some limitations on charges, which effectively say that you can't charge someone who is eligible for financial assistance more than you would charge someone who is not eligible for financial assistance, or who is paying via different methods. And then the last is there's some billings and collections policies and procedures. So what you can and can't do when it comes to collecting from people who are eligible for financial assistance. Again, all important things, all hopefully things that your hospitals have already addressed. But today we're going to talk specifically on the community health needs assessments. So these rules apply to all licensed hospitals. So the first thing you need to do is, first thing is, are you a 501c3? Second, are you a licensed hospital? So that goes back to, organizations that are licensed by the state as a hospital, not as a clinic, not as another type of entity. It's going to apply to governmental hospitals only if they have dual status. So some governmental hospitals would have applied to the IRS at some point and received 501c3 status. So they're tax exempt 2 ways. 1, by virtue of being a government entity. 2, by having that C3 status. The failure to meet any of these requirements can result in the loss of your tax exempt status. Now, there's some exceptions that are put into the rules with respect to minor errors, minor omissions that could happen and are due to reasonable cause. So some of the examples they would show there with respect to community health needs assessment is you had your assessment available on your website. Your website crashes for a couple of days. So you have some days where it's not publicly available. They'd say that's a minor reasonable error. There's also exception for errors that aren't egregious and are due to reasonable cause. These types of errors you need to correct, and then you need to disclose that you had that error on your tax return. So examples that they would give there is an organization conducted its community health needs assessment. However, it didn't get it approved by its board by the end of the tax year, or it didn't complete all of the steps, and its report didn't have all of the required pieces that it needed to have in there. So we don't want to get into a situation where you have to rely on, we had an error, and because of that error, we're arguing that we shouldn't have a loss of tax exempt status. With respect to community health needs assessments, there's an additional penalty that applies. So there is a $50,000 annual fine that's assessed if your assessment is not completed timely. So that would apply in addition to the loss of tax exempt status, and that will apply for any year where your assessment has not been completed. So if you're an organization, and let's just use a calendar year just for simplicity. Let's say that you have to do your community health needs assessment during calendar year 2024. If you don't have it completed by the end of 2024, there would be a $50,000 penalty assessed for 2024. Let's say you don't get it done in 2025. There would be another $50,000 penalty assessed. And if you completed it in 26, then that penalty would stop accruing. You are required to do this process once every 3 years. So there's kind of a 3-year rolling cycle. And the intent is that not only are you doing this assessment, you're figuring out what the needs are of the community, but there's actually an intent that you're doing something with those results and you're trying to make an impact on the needs in your community. So the idea is 3 years later, if you come back to do your next assessment, that you would see that there's been some change with respect to those needs. It may not be that those needs go away. I mean, we all know there's a lot of health needs that a community might face that can't be cured within 3 years. But we want to see that there's been some action taken and some impact that can be reported. This process, which we're going to talk through, it requires you to do the assessment. It requires you to document the results in a report and make that report publicly available to the general public on your website. And it requires that you adopt an implementation strategy. So that strategy is going to be, here's what we found. Here's what the hospital plans to do to address the needs that we identified. That implementation strategy also needs to be made available on your website or in different manners, which we'll talk through. So when we think about having to conduct this once every 3 years, then we get to the question of, well, what does it mean to be conducted? And it means that it's the taxable year in which that report is made widely available and is approved by the authorized body. An authorized body typically is going to be your governing body. It can be some level of committee within your governing body, as long as that's permitted under state law, and as long as your governing body has authorized that committee to approve the report and the implementation strategy. And I will note with the implementation strategy, I'll touch on this later, but when we talk about the same year, the implementation strategy actually has an additional 4.5 months to its due date. So again, going back to my example, if you have a report that's due in this process, you need to have it done in your calendar year of 2024. You would need to have the process completed, your health needs assessment report approved by the board and posted on your website by December 31st. Your implementation strategy has to be approved by your board and posted on your website by May 15th of 2025. So you get that additional 4.5 months to complete the implementation strategy. Now, some organizations don't take advantage of that. They're going to go to their board once. They're going to take the community health needs assessment report. They're going to take their implementation strategy report. They're going to get it all approved at once. That's great. But just know that if you don't have time to get it all done, you do get that extra 4.5 month window to get the implementation strategy completed. All right, so let's talk about the process. So if you're brand new to this, you're starting out, you're thinking, I don't even know where to start. Well, the first piece is to define your community. So the IRS says that you have the flexibility to define how you're going to talk about your community when we think about, okay, we're going to assess the needs of our community. You can use geographic boundaries. So you could use zip codes, you could use counties. A lot of organizations might already have what they consider to be their primary service area, their secondary service area. You can define community using those types of geographical areas. You can define it by a target population. So let's say that you are a women's hospital. Well, you may not want to define it by a geography because you're not going to serve everyone in that geography, but you might define it by, a target population of women within this community. Or it could be a principal function. So if you're an orthopedic hospital or a hospital that has a specific function, you can define it that way. If you're going to do a community health needs assessment in conjunction with others, which is allowed, you have to define it to include all populations in all areas that each of you is planning to address. I'll talk a little bit later, but you can do joint reports, but in a joint report, both hospitals or all hospitals have to define their community the exact same way. If you are going to do separate reports, but one process, you can define community more broadly. And then within your specific report, you would just define how, or indicate how you defined your community within that larger community. One key is you cannot define your community to specifically exclude the medically underserved, minority, or low-income populations. I don't think most hospitals would do that, but let's just say that you have, let's say that there's a Indian health Indian reservation near your facility. You can't specifically carve that out if that location would be using your services. So you can't pick and choose who within your community you include in your report. This is just an example of a report that we have done where we define the community served. So you'll see here that for this one, community was defined as all residents within 6 Minnesota zip codes, which are noted in yellow on the map. We indicate that we included all members of the community, regardless of their ability to pay, whether they were eligible for financial assistance. We then show the boundary of the county where the hospital is located. And part of why we define that is some of the data that we are going to have to pull might be at a county level versus a zip code level. And then we talk about why did we choose this? And it's because of the presence of our locations within this region and where most of our patients reside. So you need to think about why are you choosing the community that you're choosing? The next step, once you've identified your community, is you need to solicit input from the community. And there's specific input that is required to be utilized as part of this process. So I've got 3 specific entities that have to be part of your assessment. And that includes at least one state or local, tribal, or regional government official, or someone from public health department or the state office of rural health. So you're going to need to include someone who has that expertise when it comes to public health. You need to include members of the medically underserved, low income, or minority populations, or individuals that specifically serve those populations. Sometimes we find that it is hard to get individuals from those populations to be part of our process. So that's where you can include, maybe it's someone from the Senior Citizen Center, maybe it's someone from a community of racially diverse individuals, and maybe it's a leader from their community who gets involved. And then you have to include written comments that you received on your most recently completed community health needs assessment and implementation strategy. Now, I will tell you, I've probably reviewed 200 community health needs assessments. I'm not sure I've seen any that actually received written comments on their prior assessment. But since you're required to include that, I would make sure that your report specifically indicates, whether you included them or not. So it might be as simple as saying the hospital would have included written comments on our prior community health needs assessment, however, none were received. And then you need to include general input from members of your community. So we want to make sure that we're getting a broad range of individuals who are providing feedback so we can understand the community's assessment when it comes to what the health of the community really looks like. It's also important, specifically with the specific individuals, but in general, that if you can't get input from one of these groups, you need to at least show that you tried. So if you contact someone from public health and that person just isn't able to provide any input, you can't connect with them, you at least need to indicate that you reached out to them, you tried to get that information, and you were unavailable to. So when we think about getting input, and as Lara and I talk, there's really three different ways that we typically are going to see that you're going to get this information. One might be by doing a survey. It might be by doing a focus group. Maybe you bring people within your community together and you have a discussion around the needs. Or you might do one-on-one interviews. Sometimes I'll see that the one-on-one interviews are really effective when we need to get that input from someone from public health. They may be more willing to sit down and do a half-hour interview than coming and attending a focus group meeting. So there's no rules as to how you get information. It just says that you need to get input. So if we talk a little bit about surveys, surveys can be a really effective way to get information from a broad group of people and get good feedback on what kinds of things they're seeing within the community. When we talk about doing delivery, there's lots of different ways you can do this. We just put a number of different ideas here. Especially if you're going to do an online survey, like using SurveyMonkey, that makes it easy for people, for you to get that information out and people to get on and access the information. So it might be putting links on the hospital website. It might be on your social media pages. Sometimes we decide that we're going to do paper surveys because there might be populations that don't have access to computers or aren't as computer literate. And so we might do a combination of paper and online. I've also had situations where we do an online survey. We print it out in paper, and that's provided maybe to someone at the Senior Citizen Center or someone at a social services center, and their individuals then can sit down and talk through it with a client, and they can fill out the survey online as they're having that discussion, or they could help them fill it out on paper and submit it back to the hospital. So think about all of the different ways that you could try to get that information out to your community. We listed here some common survey questions. Laura also has developed kind of a sample survey that you could use as a starting point to getting information back from the community. Really what you're looking for here is getting specific information on, where do they see shortages in maybe the healthcare services that are currently provided? Where do they see issues that can be addressed by health, or things that are preventing people from getting healthcare services? Here's how do you view the following healthcare topics in your community? What I typically recommend in doing a survey is trying to limit the amount of open-ended questions, because open-ended questions mean that then you have to go through and read them all and analyze them all. So doing questions that can be answered with a checkbox or filling in circles are typically going to be easier when it comes to reviewing and assessing the survey. So you should all have copies of this, so you'll have this information to utilize in the future. This is a copy of as I mentioned, Laura and her team are going to develop a number of tools that could be used in doing the assessment. So this is an example of the survey tool that they've created that could be utilized by your organization, either doing it like this on paper, or you actually could use these same questions and build it into a Survey Monkey. I just gave an example here. Survey Monkey is what we use when we're doing these surveys for hospitals. It's a very user-friendly tool. It's pretty easy to go in and set up the questions. And what I really like about it is you get some really great information back out of the survey tool. So this is an example of an organization that we worked with that did a survey. You'll see they had 853 people who responded, or I guess 857 since Forrest skipped this question. But the survey tool accumulates all those answers, and for each question is going to give information back already put together. So in this case, you can see, if you received medical care in the last 12 months, what care did you receive? They gave these as options. So you can see how many people chose each option in a graph format. And then over here, same question, they give you the percentage that responded to each. So this makes it pretty easy to be able to see where these answers are coming in versus having to read through all of the responses. I gave an example here where specialty care, it says, please specify. So this would be where people wrote in answers. So you would get a long list, in this case, 245 responses that then need to be read through and analyzed. So I would just, keep that in mind if you're going to use a survey and develop those tools, that using a tool like SurveyMonkey can really save a lot of time. The next thing that you could do is a focus group, and we often do this in our assessments, is identifying some key people within the community that you want to get input from. So we put together a list here. This isn't all inclusive. This doesn't mean that you have to have someone from each of these buckets as part of your focus group, but it might give you an idea of who you might want to attend. When we do the focus groups, we typically, might send it out to 20 to 25 people, hoping that you might get, 80% of them to show up. We usually would say, it's an hour to a 2-hour meeting, and we just want to have open discussion, get feedback on, specific questions that we have with respect to the community health. Again, here's some common focus group questions. These are just a couple that I threw out here. The tools that Laura is going to provide will have some additional questions that you can use to kind of trigger discussion when you have this group of people together. The last piece, or I should say, and if you were going to do the one-on-one interviews, you could use those same questions when you're talking to someone one-on-one. You could use some of the questions that were in the survey, but that conversation is really intended to drive to some of the same results, some of the same needs, identifying those things so that you can put it all together and start to see some of those common themes popping up. In addition to that community data, we also recommend that you do some quantitative data. So that's going to be some information that you can get off of the internet that's going to give you information that's been gathered by other organizations. The one that we use most often, Laura's team also uses this, is county health rankings. So this is a model of community health that was developed by the University of Wisconsin. And this looks at a number of 30 different measures on community health. And they're going to take those different things, and it's done on a county by county basis. And it's going to rank all of the counties in your state. And it's going to give you, if you look at your specific county, it's going to give you that ranking on both health outcomes and health factors. So what are those things that are impacting the health of your community, and health outcomes are length of life, quality of life type factors. So this is an example of what you would see if you were to go out to the county health rankings and roadmaps for Oklahoma. So you're going to see that when they look at the state, those counties that are considered to be the healthiest are going to be the dark blue on down to the dark purple. So that's kind of their measurement factors, and then those same colors will fall within your specific counties within the state. And then for each county, they're going to give very detailed information. It's great information that you can kind of pick and choose through. I gave an example here. I think this is from a hospital that we worked with in South Dakota. And you'll see that when they defined their community, their community went over 3 different counties. So that's okay. What we did then is we grabbed the information for each of those counties and then tried to see how they all can combine together to give us some information. So within the county health rankings, they're going to give areas of strength for that county and areas to explore based on where you are relative to the US overall and where you are relative to your state. So if you looked here for this organization, when you look at areas to explore, you're going to see that adult smoking, adult obesity, excessive drinking are showing up on all 3 counties. So that could be an indication that those are some significant health needs in your community. You'll see here, this county had driving alone to work. So that's a risky factor, could fall asleep, could end up in a car crash. But that's not showing up in any of the others. So it's something that might be worth thinking about, but it probably doesn't rise to the level of as concerning as those that are showing up, as areas to explore throughout all of the counties. And then really what you would do is you would take all of this information that you've gathered. So the data, the information you've gathered from your survey, the information you gathered from your focus group, and you start to look at it and assess and think about, well, what are some of these health needs that seem to be bubbling to the top? Are we seeing consistency amongst what we're hearing on the survey, what we saw in the county health data, what we hear from our focus group, what our county health person tells us? And you start to identify kind of those priority needs. And you might come up with 10 to 15 different needs that seem to be out there. That doesn't mean that those are the ones that you're actually going to do something about. Those are just needs that seem to be significant. The next step is for you to prioritize those needs. So you're going to use factors to prioritize those needs to figure out, well, which are the most critical? Which are the ones that we think we should probably be addressing, and why? And the factors that we might consider here. So the scope, the burden, the severity, or the urgency of that need. What's the estimated feasibility or effectiveness? So sometimes a need might come up like healthcare cost is too expensive. Well, we all know that might be true, but how feasible is it for us to make an impact on the cost of healthcare or how much insurance covers? We might want to impact that, but it might be hard for us to impact. We might want to think about the health disparities that are associated with the need, or the importance the community places on the need. So if you have things that show up in the county health rankings, but don't show up at all as concerns within your community, they might be needs, but they may not be, you might not put a priority on them because your community isn't seeing that as a need. So you go through this prioritization process, and at the end of the day, you're going to come up with your priority needs. And I typically recommend that those priority needs probably are 3 to 5 of the needs that you feel are the top needs, because those are the ones that you then are going to report on. And the hospital is going to say, these are the priority needs, and this is what we're going to do to address those needs. You also need to assess, well, who else in the community is available to address those needs? So just because something rises to the top as a priority doesn't mean that the hospital has to address that on their own. It's very common, and it's a best practice for you to identify others in the community that could help to address it. There's social service agencies, there's county, or there's governmental agencies. Maybe there's other hospitals, maybe there's dentists, maybe there's, a senior services entity. There's lots of entities within your community that you can collaborate with to address the needs that are identified. It's not strictly the hospital's responsibility. Yes, that was this slide. That's what I was just talking about, is those community resources. So that's your process as far as getting that community assessment done. So then the next step is, now you've got to put that to paper. So now you have to come up with your report that's going to document everything that you did with that process. I typically see that you're going to probably be writing the report as you go. But these are the components that have to be in your report. So keeping these in mind as you're doing your process is important. So the first is the description of the community and how you determined it. Second is a description of your process and the methods that you use. So how did you gather data? Did you do a survey? Did you do a focus group? Did you do one-on-one interviews? If you did a survey, how many surveys did you get back? How did you get the survey out to the public? If you did a focus group, how did you determine who was going to be part of your focus group, and how many people actually participated, and at what times was that happening? Did you collaborate with any organization? So did you do it with another hospital? Did you do this process with county health? Unfortunately, or interestingly, a lot of times the county health departments also have to do community health needs assessments. Most states, they're doing theirs on a 4 or 5 year basis. It would have been great if the two entities collaborated, and the IRS and the health department said, well, let's all do it on a 4 year, and that way we can do them together. So you might get lucky. You might find that your county health department is actually doing their assessment at the same time, and you can collaborate. You might find that they've done a really detailed survey, and you could use the results of that survey in yours and not do your own survey. So I would definitely reach out and see if there's ways that you can collaborate with the county health department. And then if you had someone help you with the process, you need to identify the organization that you contracted with that assisted with the process. You need to generally describe how you took into account input from the broad interests of the community. In this case, you really want to make sure that you can identify who from your focus group, or who did you have the interview with, that represented the needs of the medically underserved, low income, and minority populations within your community, and how those individuals were identified. So I always want to see a report that specifically calls out those populations and what you did to ensure that you got input from them or from organizations working with them. We typically are going to want to identify the organizations that provided input, but you do not have to list specific individuals. So you could list, our focus group included representatives from the local school district, from our emergency room physicians, the local dentist. So you can describe them by virtue of their occupation or their role in the community. You don't have to put specific names. You need to identify the needs that were identified and a description of those needs, the criteria that you use to determine which ones were most significant, and your criteria that was used for prioritizing the needs. When it comes to the prioritization of the needs, that can be done either internally or externally. So with some organizations, they'll choose to have, they'll, instead of doing just a focus group, they might identify that they're going to have a community health needs committee. And so it's going to be a committee of people from the community that first is going to provide input, and then secondly is going to take all of the input that's received, and they're going to help the hospital prioritize those needs based on the information that is gathered. Other hospitals will say, we'll have, we'll get all of the data from the community, but then we're going to have a task force within the hospital that's actually going to prioritize the needs. Either way is fine. It's a choice. You can make that choice. You just have to make sure that you're identifying how that process worked. You do have to identify the resources potentially available to address your needs identified. So those are those social service organizations, nonprofits, government. And within your report, you do have to have an evaluation of the impact any actions taken since your last CHNA. So you need to identify, you go back to your prior report or your prior implementation strategy and indicate that in the report that was done 3 years ago, these were the significant needs. These were the actions that have been taken by the hospital with respect to those needs. And here's the impact that we've seen in our community. Again, you don't have to solve those needs. It's okay if they show up again, but you want to be able to show that there has been some impact on the need over the last 3 years.
Kim, this is Laura. I had a
Yeah.
quick question. You mentioned that you could defer to another group or have another entity help in prioritization. Do you see hospitals working with their patient family advisory councils on this? Do you see them incorporated into this process?
I have not specifically seen that kind of a council being involved, but I definitely think you could if
Okay.
you feel that that has a broad representation of your community.
Okay. I was just curious because I know that is something a lot of our hospitals are working on is reinvigorating those
Sure,
councils and committees. So thank you.
absolutely. I mentioned this already, but with your reports, you can do a separate report or a joint report. Um, with your separate report, you can have identical portions of a report, but your report has to be specific to your community and what you're doing with respect to the needs for your community. If you do one joint report, then all hospitals have to define the community the same. So this, I think a joint report really only works well if you have a hospital who's in close proximity and both entities would define their community the same. So both hospitals would say, well, our patients primarily come from, the same community. I don't know that I see this as much, maybe in a rural setting as I would potentially in a larger city. I've got one hospital group that I work with where there's 3 large hospitals within one major metro, and they have chosen to do a joint report together because they all are defining their community as that major metropolitan area. And then within that joint report, there's sections that says this hospital is going to identify these needs, and these are the actions that they're going to take with respect to those needs. Mentioned earlier that the report has to be made widely available. So there's two ways that you must make your report widely available. First is it has to be on your website or the website of another organization, and it has to remain on the website for until two subsequent reports have been posted. So in other words, it'll be out there for 6 years. You also must make a paper copy available at the hospital facility, and you always have to have 2 cycles of reports available. The implementation strategy. So once you've finished your report, once you've identified those prioritized needs, now the hospital has to do an implementation strategy in writing, and it has to address each of those significant needs that were identified. There's 2 sections to this. The first is the needs the hospital intends to meet. So if, let's say that you've got adult obesity, drinking and drug abuse, and the need for more physical activity within your community, and then the need for dentists. So the hospital might say, well, we're going to take the first 3 because those are things that we feel like we've got programs or things we could do, or we could collaborate with others in the community to address. So in that case, they're going to take those 3 needs and they're going to put actions that the hospital is going to take and the anticipated impact of those actions, the resources that are going to be committed. So whether it's time, whether it's staff, financial resources, any collaborations, and then what plans you're going to put in place to evaluate the impact of those actions, because you're going to have to report on them 3 years later. For the needs the hospital doesn't intend to meet, so in my example, dental care, you have to explain why the hospital isn't going to meet that need. And it could be resource constraints, it could be lack of expertise, it's a low priority, there's lack of interventions, or others in the community are more able to address it. So in that case, you might say, we're not going to address dental needs because we don't provide dental services, and there's dentists within the community that do provide that service, and we will ensure that they are made aware of this need. So just because it's a need, you don't have to address it. I have plenty of hospitals that I read their implementation strategies, and they say, due to resource constraints, we can't address all of these needs. So we're going to address, 1 or 2 of them that we feel have the biggest impact on the community. And then again, this doesn't have to be done by the end of your taxable year, but it needs to be completed by the 15th day of the 5th month after your year end and posted to your website. The alternative here is if you don't want to post that to your website, then you need to attach it to your Form 990, and it would get attached to your Form 990 each year within that 3-year cycle. The other reporting requirements. So those of you who are filing a 990, which most organizations that are 501c3s are going to be filing a 990, there's some exceptions there for those dual status governmental hospitals, but in general, most organizations are filing a 990. There's a whole section in Schedule H of the Form 990 where you report on the fact that you've done a community health needs assessment and what the results were. So there's some general reporting just on how you conducted it, what was included in your report. As long as you do your report, based on what we just talked about, you'll be able to check all those boxes. Any excise tax that you were assessed because you didn't do the community health needs assessment, hopefully we're not going to see any of that. With the implementation strategy, did you do an implementation strategy? Is it publicly available on your 990, or are you going to attach it to the 990? And then there's specific questions that ask about what actions has the hospital taken in the current year to address the needs that were identified. So this really needs to be refreshed annually. You really want that to be reflective of what your hospital actually did. Oftentimes I'll see that people, will just give me a reiteration of what they put in their implementation strategy. So they'll say, we intend to do this, we intend to do this. And that's not what they're asking for here. What they're asking for is, during the current year, what did you actually do? So keep that in mind. I think it's a best practice to have someone within the organization responsible for ensuring that we're taking steps related to the implementation strategy. So whether that's a specific person or whether you have some committee within the hospital that's on a regular basis assessing what you've done and what you should be doing to meet those needs. Then I'll wrap up with just a few other considerations. Hopefully, we want organizations to think about this beyond just it's a requirement. And it is a requirement, but I do think that there's some real benefits that you can get from doing a community health needs assessment. It helps your community to see that you care, to see that you're not just doing what you think should be done, but instead you're looking at what's important to them, what needs there are, and how you can make changes to help impact those needs. It helps us to see where there's gaps in care. It might help us to see where people have barriers to receiving care. From a hospital standpoint, it can help you to see where you have outbleed, where if you all of a sudden ask a survey question of where or what services are they getting outside of the community, it can help you to understand that maybe those are some of the services you need to bring in with specialty services. There are at least 12 states that require some level of community health need assessment. Oklahoma is not one of those, but I do anticipate that we're going to continue to see more states looking at this. It does strengthen community relations. It can help you collaborate with other providers in your community. I've seen some great examples where, as a part of this community health needs assessment, 3 or 4 nonprofit organizations are coming together and they have a quarterly meeting with the hospital, and they're collaborating and figuring out really what they can be doing to help the community. And it's a really great way to build just community camaraderie and to show people within your community that you're trying to make a difference. And I mentioned a little bit, but this strategic planning, I don't know how many organizations currently have a strategic plan, but what a great way to kick off a strategic plan by being able to understand what's happening right there within your community. Where do you have a desire for more services? Which services don't you have that other people would like? Do you have some capabilities that could go a long way towards meeting some of the needs that the population has? Can help you to allocate your resources differently. So it can be a great kickoff to doing some kind of strategic planning. And then can't leave without also saying there also is a little bit of stick from the IRS. So Congress does require the IRS to review every hospital once every 3 years to assess their compliance with these 501(r) rules. You probably aren't even aware when this analysis is being done, because it's done as a desk audit, which means the IRS agent is going to pull your hospital. They're going to pull your 990. They're going to pull up your website. They're going to check the boxes to see that you have the community health needs assessment and the implementation strategy on your website. They're also going to check for the other components of 501(r) that are required to be on your website. They're going to read the narratives that are in your 990 to see how you're describing what you're doing. Typically, if they find that there's items missing, they're going to do a soft compliance check. So they're going to send you a letter and they're going to say, we noticed that you have your community health needs assessment on your website. However, it doesn't indicate that it was approved by the board. Please provide support that it was approved by the board. Those types of soft checks, they typically are requiring you to correct it. It's more educational and it's more voluntary compliance. If you don't respond to that check, or if they, look out there and they don't see that you have things that are supposed to be out there, then it can trigger an actual field exam where they might come in and just review your compliance with 501R, or they could expand that and they could do a full audit of the hospital. So you really want to make sure that these are things that you're keeping on top of and that you're following all of the rules with respect to 501R. So with that, Lara, do you have any follow or wrap up that you'd like to talk about with respect to the tools that your team is making available or processes?
Yes, absolutely. As Kim mentioned and showed the survey template, we are working on templates. And so we generated, let's see, a template of the survey for one, interview questions. Folks can consider including if you do focus groups and or interviews. We shared those with Kim to review, to have her CPA lens go over them. And so Kim got the comments back to us. I'm working through making those revisions, and then I need to get some internal approvals. Hopefully by the end of August, I can start sharing those. What I'll do is email those out, but then we will find somewhere to house them on one of our websites, and I can then direct folks to those. One other thing I think I failed to mention is one of those is a report template. And so I know folks on the call are probably thinking, where, when I go to start documenting this, all I see is a blank Word document. We have a template where it kind of prompts you along to make sure that you document the methodologies and how you invited folks and how you did this, and try to answer as many of those check boxes as possible. One other thing I wanted to touch on, Kim and I were emailing this morning about the data, the quantitative data to consider. And we both landed on county health rankings for a couple of reasons. One was the wealth of information that Kim shared in the slides. The other is it's one of the most user-friendly sites that's available with data. And so the only prerequisite you have to do is just put in your county on that main page, and that then all of the information is generated. And so it will pull up your county in comparison to Oklahoma, in comparison to the United States. And so it's a wealth of information. Going back several slides to the beginning of defining your service area, most of our counties, well, hang on. Some of our counties do look just at your county, our community. I mean, look just at your county. We have many others who drill down into your zip code. And, the folks who've worked with us in previous years, we do drill down, map out your medical service area, your primary and your secondary service area by zip code. That data are largely available from the census. And so the census is a great resource. I mean, I love it. It's a great resource, but it can be a little overwhelming. So if you would like to dive into census data, zip code data, or anything that's not captured on county health rankings, please do not hesitate to reach out to me. You know me, I love diving into this stuff. So as I mentioned at the beginning of the call, if you get off of here, or if you meet with your team members, or if you get weeks down the road and have questions, or if you get in the middle of your assessment and have questions, please do not hesitate to reach out. We want to be here to help you work through this. And so with that said, let me check the chat real quick. Does anyone have any questions about what was presented today or moving forward that's on the call right now? Okay, well, while everyone's thinking, one other comment I wanted to make was, the interviews, we started incorporating interviews in during COVID because we couldn't do in-person meetings. But I think this is a great opportunity for our facilities to make that partnership early on. We talk about identifying partners once we're working on our implementation steps. Doing the interviews in your facility, folks from your facility doing those interviews with folks in your community, that it's a great opportunity, and it's a great relationship building opportunity. So one last call for questions. Kim, is there anything else you'd like to add before we end?
No, not at all. Just thank you for letting us be part of this and letting us be part of the process. And I um, do have my contact information on the last slide, so feel free to reach out if you have any questions beyond what you reach out to Laura and her team on.
Excellent. Thank you, everyone. And please let us know if you run into any questions or concerns. And everyone have a great rest of your day.
Thank you.